Hello, 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 NCLEX Crusaders. Welcome to our YouTube channel. Welcome to our live training on Pass the NCLEX Step by Step. And today's topic will be disaster triage. How to answer NCLEX style questions related to disaster triage. So if everybody can hear me, please go ahead and let me know on the comment section if you are able to hear me okay, so we can begin our YouTube, Facebook Live. All right, all right, all right. Thank you, thank you. Welcome everyone. Everyone joining on YouTube and Facebook. Okay, perfect. All right, let's begin our training. So if you're here for the first time, welcome to NCLEX Crusade International. My name is Rainier Arado. I am a registered nurse here in the United States. And today's topic will be disaster triage, how to answer NCLEX style questions related to disaster triage. So we will talk about a specific strategy that you can only use in this type of questions. I know that many of you, if you've been following our YouTube channel, NCLEX Crusade International, you probably have learned the assessment versus implementation strategy. You have probably learned the Maslow's hierarchy of needs strategy, the SAR method strategy, but this strategy that you will be learning today only applies to disaster triage style of questions. I hope this training is very beneficial to you. If you are in nursing school, this training is beneficial as well. Remember, for those students out there that you're enrolled in a nursing program right now, it is super important that you are preparing from the NCLEX, that you're preparing to pass the NCLEX from day one. So let's begin today's training and let's see how your critical thinking is doing today. So what is a disaster? A disaster is a human-made or natural event that causes destruction and devastation that cannot be alleviated without assistance. So that's basically what a disaster is. And there are different types of disasters. We have internal disasters, those that are located or occur within a healthcare agency, and we have external disasters that occurs outside the healthcare agencies. And disasters can be many things. It could be a fire, it could be a hurricane, it could be a tornado, it could be a lot of things. The most important thing to know for you, for the NCLEX, is how does the nurse respond whenever we have a mass casualty event or a disaster? Why is this important for you? I have seen many nurses making huge mistakes when answering disaster planning style of questions, or when they are prioritizing mass casualty event style questions, because the priority order changes a little bit. And we will discuss those questions today. In a disaster, triage consists of a brief assessment. The nurse has to conduct a brief assessment in order to identify what is going on with the patient. You have to identify the severity of the injury. What type of treatment does the patient require? And what you as a nurse, what is your priority nursing action in order to help those patients in need? But what is the problem when there is a mass casualty? What is the problem with triage when there is a disaster? The problem is that you could have 100, 200 patients in one time, coming everybody towards you, and you don't have all the time in the world to do your usual head-to-toe assessment. You have to do something more simple, something that is faster. A type of triage that is used in disasters or mass casualty event is known as the simple triage and rapid treatment start. Basically, this is a strategy that it is used to evaluate the severity of injuries to each victim and find a solution quickly. Now, the important key factor of this type of triage is that it needs to be done within 30 or 60 seconds. So in 1 minute, the triage needs to be done, and you have to do something to start helping these victims. Now, what is a keynote, a key factor to prioritize whenever there is a disaster or a mass casualty event? The priority is survivability. It's not only who is the most unstable patient, but you need to identify what patient is unstable but has a higher chance of survival. That is the key when you're answering prioritization style questions that deals with disaster or mass casualty event. So I will show you an excellent strategy that I have developed that could help you understand and can help you answer these types of questions. The strategy is this one. I want you to take a photo of it, write it down, because you need to learn this strategy in order to answer these type of questions. This simple strategy has 3 steps. Step number 1, you're going to review the NCLEX question. You're going to see that the question deals with a disaster or a mass casualty event. Once you have determined that you are indeed facing a mass casualty event, a disaster event, you have determined that, and the question deals with triage, what patient you will be seeing first, you have to ask these 3 questions. Number 1, which victim sustained injuries that are life-threatening? That is an important key factor. Question number 2, which victim sustained injuries that are non-life-threatening? And question number 3, which victim can survive? Which victim has a higher chance of survival? Once you have determined this, what is going to be your next step? So if you're reading a scenario where you have victims that sustain life-threatening injuries and you have other victims that sustained non-life-threatening injuries, it is very common to understand that you will be eliminating the patients that sustained non-life-threatening injuries. So, first step, you will identify who has life-threatening injuries and who doesn't. Step number 2, you eliminate any patients that has non-life-threatening injuries. And then you are going to keep only the patients that have life-threatening injuries. But you see, there is nothing new that you probably already know from understanding prioritization. But this is the key or the turning point. In step number 3, you have to ask, which patient has the highest chance of survival? So what will be your priority answer? Which patient will be your priority in a mass casualty event, in a disaster event where you have multiple victims? Your priority patient will be the one that has a life-threatening condition but has a high chance of survival. That will be the correct answer. So I want you to see a scenario. So let's practice a question together so you can see this strategy in real life. So let's review this question together. And as soon as you know the answer, go ahead and comment on the comment section. If you are on YouTube, comment on YouTube. And if you are on Facebook, do the same in the Facebook group. So basically, the question says, 30 people are injured in a train derailment. Which client should be transported to the hospital first? As you can see, you're dealing with a mass casualty. You have 30 people that were injured in this accident. This is the key to understand that you will be using the strategy that I just taught you. Let's follow the steps of the strategy. So in step number 1, you have to identify which victim sustained injuries that are life-threatening. So let's go one by one and determine which answer is a life-threatening injury. Answer number 1 says a 20-year-old who is unresponsive and has a high injury to his spinal cord. Do you think this is a life-threatening injury? Absolutely. This is a life-threatening injury. Okay, perfect. Let's go to patient number 2. An 80-year-old who has a compound fracture of the arm. Do you think patient number 2 has a life-threatening injury? Nope. This is a non-life-threatening injury. I'm just going to abbreviate to make it easier. Answer number 3. A 10-year-old with a laceration on his leg. We don't have to do much thinking here. This is a non-life-threatening injury. And answer number 4, it says a 25-year-old with a sucking chest wound. This is a life-threatening injury. It's very important that you understand how to do these steps, because these type of questions can get very complicated. And if you don't know the basics, you're going to make a lot of mistakes. So step number 1, I determined which patient has a life-threatening injury. Step number 2, I determined which patient has a non-life-threatening injury. What is the next step? Eliminate any answer that contains a non-life-threatening injury. So answer number 2 and answer number 3 is eliminated. So far, we're doing good. We have already eliminated 2 answers. We have 2 answers left. Answer number 4 and answer number 1. Look at step number 3. Which patient has a higher chance of survivability? Which patient has a higher chance to survive? Number 1, a 20-year-old who is unresponsive with a high injury to the spinal cord, or a 25-year-old with a sucking chest wound. The patient that has the higher chance of survival is patient number 4. Therefore, answer number 1 is eliminated. As you can see, This strategy is very simple to use if you follow these steps. If you follow the 3 steps that I just showed you. Now, let's look at another question. It's going to be a little bit different. Now, it's going to be a question that you have to put in order. You have to see these 4 patients and you have to determine which patient you will see first, second, third, and fourth. You can use the same strategy I just taught you, because although these questions you have to put in order the answer, you still have to determine which patient has the priority. And what patient will have the priority? Life-threatening condition with survivability. Then, what's going to be my next option? Maybe a patient that is more stable but needs emergent care. And I'm going to leave for last resource the stable patients or the patients that are expected to die. They are so unstable that they will probably die within the next few minutes. That is going to be my last patient to see. As you can see, that is probably the most unstable patient, but those patients don't have a chance of survival. So we're going to leave those patients for last. So it says, the nurse in the emergency department is triaging victims of an airplane crash. You're going to see here the keyword victims, plural, more than one victim. And then we have a big accident, airplane crash. It doesn't specify exactly how many patients are in this scenario, but we can assume that there are a lot of patients. Okay? So, prioritize the clients in order in which they should be treated from first to last. So, what are we going to do? The first thing that I want you to do is I want you to determine which patient has a life-threatening condition and which patient has a non-life-threatening condition, because that's going to be useful to prioritize. So answer number 1, 75-year-old with a 2-inch laceration on the left forearm. So what kind of injury do we have here? We have non-life-threatening. Answer number 2, a 22-year-old laceration to the left temple, slightly confused. So we have a non-life-threatening. Answer number 3, 14-year-old with a 2-inch laceration to the chin, history of asthma, respirations 26, and audible wheezing. So with a history of asthma and now a high respiratory rate, because the normal is 12 to 20, with audible wheezing, this patient is probably experiencing exacerbation of asthma. So answer number 3, I will consider it a life-threatening condition. Answer number 4, 22-year-old female, 36 weeks pregnant with contractions every 10 to 15 minutes. So this patient looks like probably going into labor. The contractions are still quite apart, 10 to 15 minutes, but this patient has contractions. Now, I don't consider this a life-threatening condition, so I will put non-life-threatening condition. Out of the 4 answers, which patient is the one that has a life life-threatening condition. The asthma patient with a probable exacerbation. So I will say that answer number 3 is probably my priority patient. Now, I have 3 answers that I determined is non-life-threatening. But out of the 3, which one needs priority care? 1, the laceration to the forearm, the left temple slightly confused, or the pregnant female with contractions every 10 to 15 minutes. So that pregnant female is going to be my next priority. So that's going to be my second answer. So I've already put in order 3, and I've already put in order 4. Now I have laceration to the left forearm or laceration to the left temple, but neurological changes, slightly confused. Okay? Then that's going to be my next patient. You see, 342 is the most common answer. That is what I see you guys selecting the most, but this is incorrect. Why? Why is that incorrect? Why this is a mistake? Because if you compare 4 and 2, we have a problem in answer number 4. In reality, we have 2 patients. We have the pregnant patient, the female that is pregnant, the mother, the fetus. That patient, when we compare answer number 4 and answer number 2, answer number 2 is the priority because there is a change in neurological status. So although answer number 4, I have 2 patients, there is no indication that my patient has any other problem other than contractions every 10 to 15 minutes. It doesn't say that the pregnant female is bleeding. It doesn't say that the patient is having any other problems. We doesn't say that the patient is having any other problems. We cannot assume that there's happening other problems. We can only go by what we're seeing. So if we compare 2 and 4, answer number 2 has the priority because there is a change in condition. Although it says slightly confused, the answer 2 is more priority than answer number 4. Then I will give the priority to my 2 patients, the pregnant female and the fetus, and lastly, I will leave the laceration to the left forearm. I need to make sure you understand this, okay? Because that is a very frequent and common mistakes I see students making. If you fall into the what if syndrome, you're going to answer a lot of questions wrong. If you start thinking, well, but what if the pregnant female is bleeding? Well, what if there's something wrong with the fetus? What if the fetus is showing a non-reassuring fetal heart? So, is that clear? Do you understand why? Remember, physiological problems has the priority. From physiological, we have airway, breathing, circulation, and then neurological status. So in answer number 2, that is the scenario with neurological changes. Now, an interesting question that I have for you to see if you really understand what I'm saying. What if answer number 2 only said a 22-year-old with a 2 inches laceration to the left temple, period. That's it. Nothing else. Does that change the scenario? Do you have a different scenario requiring different responses? Yes. If answer number 2 only said laceration to the left temple, period, with no changes neurologically wise, then we would give the priority to the pregnant female. This is why it's so important for you to analyze each scenario. The mistake I see a lot of nurses making is that they read a question somewhere, maybe they memorize something somewhere, and they try to apply it to all the types of questions. It doesn't work like that. You have to analyze this scenario specifically that you have in front of you. Okay? All right, do you want to practice another question? You want to practice more? Guys, if you're liking what you're seeing, if you like the interaction that I'm doing here every other week, sometimes 2 times per month, sometimes I do a 7-day training and I spend a whole week teaching you guys. If you like it, please go ahead and support my YouTube channel. Like the video, share the video with other nurses. Make sure you are subscribing to our YouTube channel. Even if you are watching us on Facebook now, make sure you find our YouTube channel, NCLEX Crusade International, and subscribe to the channel so you can see everything that we provide every month. Ademodi, I passed my NCLEX. Thanks. Thank you very much. I've seen a lot of pass in the past weeks from nurses here on YouTube that have been joining our community, and thanks God they have been able to pass. I know that there's a lot of you that have also joined our NCLEX Crusade International membership. I think last month we went over the 1,700 members in our NCLEX Crusade International membership. So thank you very much. And I have instructed my staff to provide the links for you on the chat section so you know what resources you have available to prepare with NCLEX Crusade. So let's go to the next question. Now this is a select all or apply. Now this is a little bit different of a select or apply. It is usually 5 answers. I've only put 4 answers here because this is a rather difficult style of questions. Read it, think about it, analyze it, and then determine which patient, which victim will be priority red victim. Now, in order to answer this question, you have to understand the tagging system for victims in a mass casualty event. So I'm going to briefly go over that. We have 4 tags. 1 is red, 2, yellow, 3, green, 4, black. If you are doing a question that states which patient is red, yellow, green, or black, you have to understand what patients you are going to allocate to each one of those tags. The first thing you need to know that priority patient, or the patients that have a life-threatening condition with high chances of survival, is category 1, red category. That is the priority. A patient that have life-threatening condition with high chance of survival. But if you have a patient with a life-threatening condition but no chance of survival, those patients will go into what is called the expectant category or black category. And they will be the last patient to see. And actually, you will not be spending time with those patients, unfortunately. Remember, it sounds kind of cruel. It sounds like that's not nursing, but we're dealing with a mass casualty event. We're dealing with a disaster. 300 patients. Which patient you're going to see? So we have to identify in these 4 answers which patient will be categorized as the red category. So remember, life-threatening and high chance of survival. So number 1, it says, a 10-year-old male with a crushing chest wound, tachypnea, labor breathing, unconscious, impaled object in the forehead. Answer number 1. What category do you think is answer number 1? Let me see your comments on the comment section. What category would you put patient number 1? The 10-year-old with tachypnea, labor breathing, unconscious, impaled object. See? Patient number 1 is not red. Patient number 1 will go into the black or expectant category. Why? 1, the patient is unconscious. The patient has a crushing chest pain and an impaled object to the forehead. That patient has low chance of survivability. So it will go to expectant category, black category, the last resource. But professor, the patient is 10 years old. It doesn't matter. The age is not a factor. It's the patient's condition and the chance of survival. This patient has very low chance of survival. So number 1, I'm going to eliminate it because that is black category. Number 2, a 49-year-old male with crushing chest pain. Notice it says the same thing as number 1. Crushing chest wound, crushing chest pain. So pretty similar. They're using similar words to confuse you. Crushing chest, but here we have wound and pain. Radiating to the jaw, diaphoretic, nauseated, has an open fracture of the left wrist. This patient, what would you categorize this patient as? Do you think this is black or do you think this is red? Answer 2. Well, first, the patient is not unconscious. It doesn't say as answer number 1, unconscious. It says crushing chest pain, diaphoretic, nauseated, and a fracture, and an open fracture. This is a life-threatening scenario. The patient will go as red category. So answer number 2 is one of my answers. Because remember, I am looking for the classification of red or life-threatening. This patient probably has the clinical manifestations looking maybe a myocardial infarction, cardiac condition, but also has an open fracture. So that is important as well. Number 3, a 75-year-old female with obvious fracture of the femur. Oh, important one. Long bone. Obvious fracture of the femur. Absent pedal pulses. What is this? Absent pedal pulses. Circulation compromise on the affected side. Tachycardia, tachypnea, diaphoresis, awake and alert. See, number 1, unconscious. 3 is opposite, awake and alert. Severe pain. This will be red category as well. Answer number 4. 32-year-old female who is unconscious. Okay, so we see the word again, unconscious. Number 4, unconscious. It's important to see these similarities. 3-inch laceration to the forehead. Ecchymosis behind the ears. Not good. Respiratory rate of 10. Not good. Shallow breathing. Rapid pulse and weak. Thready. No breath sounds on the right side. This is a life-threatening condition, but low chance of survival. This will be black or expectant category. So as you can see, one of the main differences between triage on a mass casualty event in comparison with triage that we do, let's say, at a hospital in a non-mass casualty event scenario, the key turning factor is not only life-threatening condition, but high chances of survival. That is key. So next time you're facing a mass casualty event, the next time you're facing a scenario that deals with multiple victims, remember the steps we talked at the beginning. Look at the answers. Which patient has a life-threatening condition? Which patient has a non-life-threatening condition? Eliminate non-life-threatening scenarios and keep only the life-threatening scenarios, but identify out of the life-threatening injuries which patient has a higher chance of survival. All right? All right, NCLEX Crusaders, thank you for joining our YouTube Live. Make sure you're liking this video, sharing this YouTube video with other nurses out there. God bless you all. I see you on the next live. Bye-bye.